Should men get vaccinated against HPV? In 2006, a vaccine called Gardasil was introduced as an effective protection against HPV, a common virus that can have serious health implications for both men and women, including genital warts, a sexually transmitted disease. HPV and genital warts increase the risk for cervical cancer in women and penile cancer in men. Initially, the vaccine was approved only for use with girls and young women. However, in 2009, Gardasil was also approved for administration to boys and young men. Amid the recent controversy surrounding the use of all vaccines, such as the now debunked study in which a British doctor erroneously claimed that vaccination is the cause of autism in infants, concerns have been raised about whether vaccinating against HPV might in fact be dangerous. Given the scare factor, as well as the possibility that any vaccine carries some risk of side effects, along with the fact that Gardasil primarily benefits women, many men have wondered whether the benefits of vaccination against HPV outweigh the potential risks. To make an informed decision about whether to receive the vaccine, it's first important to understand what HPV is, how HPV spreads, and how easily it can affect men's health, as well as the health of their sexual partners. HPV is short for the human papillomavirus. This is a disease that's spread through skin-to-skin contact and is most often passed on from one intimate partner to another. It's so common and so highly contagious that 9 out of 10 sexually active individuals will be infected at some point in their life. Fortunately, most people never have visible symptoms or suffer any effects that are harmful from the virus. However, HPV is responsible for about 90% of cases of genital warts. In women, these can appear on the inside or outside of the vagina or anus or on the thighs. Men can develop warts on their penis, scrotum, and thighs, or inside and outside the anus. Now, the warts themselves aren't harmful, although they can cause pain during oral or penetrative sex or masturbation. The embarrassment factor is another story, since anyone who has visible warts will advertise to their partners that they have a sexually transmitted disease. While there's no cure for HPV warts, about 90% of the time they go away on their own, although it can take up to 2 years to see the symptoms disappear. The other 10% of the time, the infection can be chronic, with the warts appearing and reappearing in the genital area over the long term. Now, so far, this doesn't sound all that serious. No harmful effects. The warts most often go away on their own. So why bother getting the vaccine if there could be harmful effects? Actually, there are 3 very compelling reasons why you should get the vaccine. First, although the warts themselves aren't cancerous, having HPV does, as previously mentioned, increase the risk for penile cancer, particularly in men who have chronic infections. HPV has been linked to about 50% of the cases of cancer of the penis, and uncircumcised men who contract HPV are at even greater risk of developing this potentially life-threatening disease. Women who are affected by HPV are at greater risk to contract cervical cancer. About 65% of cervical cancers can directly be related to the HPV virus. About 4,000 women per year die from this disease in the U.S. alone. Third, throat cancer, actually affecting the throat, tonsils, and base of the tongue, has been likewise linked to HPV. While historically attributed mainly to alcohol and tobacco use, cases of throat cancer caused by HPV are on the rise. In fact, according to the National Cancer Institute, HPV is currently the leading cause of throat cancer, especially in younger men. Now, an important point to remember is that any unvaccinated person who's been exposed can carry the virus and pass it on to their partner, even if they never develop warts. This means that any contact between people who are not vaccinated can result in contracting the virus. The most often ways of contracting the virus are oral sex, penetrative sex, open mouth kissing, or even any form of skin-on-skin contact. By receiving the vaccine, men and women drastically decrease the risk of becoming infected with HPV, as well as reducing the chances that they'll pass the virus on to their partners. Research by the Center for Disease Control states that vaccines available for HPV prevention are highly safe and effective and typically cause only minimal and temporary side effects. As with any other medical decision, the choice to receive the vaccine or not is one that every man should make in consultation with his doctor. It's an option that men should responsibly consider as part of an overall health and sexual wellness strategy.